Hi, this is Dr. Michael Ryan with Missouri Vein Care, Facebook Live, answering some questions that people have sent in that I think from the span of questions, it's pretty common questions that people have, so I wanted to share those with you and give you some answers directly from me. So one person wrote in and asked a very common question: does insurance cover treatments? That's a big concern for people, the finances of it. And in fact, the answer is that virtually all insurance companies have some degree of coverage for vein treatments. It varies by insurance, it varies by your plan, so it's quite specific to your situation. But insurance companies recognize that this is a circulation condition, so they do provide coverage. Rarely do we find one that doesn't. The best thing to do to figure out exactly what your plan involves is either to contact the insurance directly, or you can contact our office, and if you share your insurance ID number with our staff, they will contact on your behalf and learn the details of your plan and share that with you. So that allows people to know that they're going to get the treatment they need and help from insurance. So another question that's really timely now for what's going on in the country has to do with the coronavirus pandemic. People are very concerned, very fearful. I'm in Columbia, Missouri right now in my office. We are social distancing in this outside in any office or any building. We're supposed to wear masks when we're around other patients. So that's a concern for people when they hear that kind of restriction. Is there a reason for me to stay away from care? And what I advise people is that not only does it not make sense to avoid all of your elective care for vein treatments, but also for other types of care, cancer screenings or heart screenings, or even dental work is very important because people can get serious complications from neglected conditions. With regard to vein treatments, the biggest impact on people's lives and their health is the reduction in activity, because they feel run down and tired, and their legs hurt and ache. And when they feel that fatigue, they slow down, they sit around more than they usually would, and they slowly gain weight. That's a very serious health problem. In fact, being overweight is the single biggest health problem in the country. So the antidote to gaining weight is to be more active, burn more calories. If you want to go exercise at the gym, that helps too. But being active is really important, and obviously having a reasonable diet that avoids carbohydrates. So I recommend to people, if they want to maintain their health, if they don't want to slide down the slow, slippery slope into being overweight and where it gets even harder to get yourself going, then getting into an evaluation is really advisable. You can do that over the internet too if you're concerned about coming in. We can do a virtual screening. People like that. It gets them the answers they want. You can share a picture of your legs if there's a specific area you're concerned about. So that's my advice to you, not only for vein conditions but for other health conditions as well. You get in to see your provider and your dentist or other caregiver. So another common question we have, actually one of the most popular blogs on our website is about restless legs. Does a vein treatment help restless legs? Restless legs, for those of you that don't have it, it is one of the most disturbing sensations that people can experience. As a vein sufferer myself for many years, I have experienced restless legs, and it is truly one of the most disturbing feelings, and I would describe it like your legs are jittery and shaking, and a buzzing sensation goes through your body. And the most unpleasant part is it always happens when you're trying to rest. So when your body is undergoing that wind down before sleep, your body starts kind of tremoring with electricity, and you cannot rest. So you have to get up and walk around. So the result is you don't sleep very much, you don't sleep well, and people are exhausted. So the bottom line is that patients who have restless legs do get benefit from vein treatments in about 80% of cases. 20% of the time they don't get relief, and that's because it's due to another cause. So when we see people with vein reflux, as we call it, the abnormal circulation in the veins, and restless legs, We tell them 80% success rate. I had a remarkable patient just in the last 4 or 5 weeks. He had been unable to get more than 2 to 3 hours of sleep a night for the last 10 or 12 years because of his restless legs. He was desperate. He had been to a number of physicians and providers, tried different medicines, and really wasn't getting any relief. And after treatments, and really it was after his first treatment, he began to notice improvement. After his second treatment, one for each leg, he noticed that he was able to sleep through the night for the first time in years, and he was ecstatic. So restless leg treatments can help. It's not 100% guaranteed. 80% of people do get relief. So if that's a concern, then the best way to get that sorted out is really to get an evaluation that would require also an ultrasound, a special ultrasound where we look at the abnormal flow in the veins, and that can give us an opportunity to, or I can look at it and tell you what my best impression is about whether your restless leg is going to get better with treatments. So another common problem that people have that they aren't aware is related to a vein condition is leg cramps. And people ask, can vein treatments help leg cramps? And for those of you that get leg cramps, you know exactly what I'm talking about. And one of the actual medical criteria, one of the medical terms of what a leg cramp is it has to be painful. So if you have something that wakes you up in the middle of the night and it's painful and hurting, then it's a leg cramp. A leg cramp, when it happens, is debilitating for people while it's going on. But one thing that most people don't recognize is that even the next day, the muscle is still sore and tender because it is such a violent assault on the normal function of your muscle. When that muscle is cramping, it doesn't get any blood flow. The muscle is starving for oxygen, and that's why it hurts so much. So no one really knows why people get leg cramps. For pretty much any condition, any association, it's associated with certain medical conditions like kidney failure, but it also is associated with vein conditions. Most providers, most patients aren't aware of that, but as a vein care practitioner, I'm acutely aware of it. And the remarkable thing about leg cramps and vein reflux is that it's highly predictable that when you have that combination, vein reflux or the abnormal flow and leg cramps, you have about a 95% probability of having the cramps go away the night of the first treatment. I tell people that, they think I'm a snake oil salesman, but it is the truth, and I've seen it again and again and again, and people continue to be amazed, and it is one of the most satisfying parts of the practice of vein care that I see, which is taking people that are in pain and getting them out of it with really the first treatment. It's a remarkable medical oddity. No one knows why this happens, but it is definitely something that is highly predictable. So if you have leg cramps, and it can be, most commonly leg cramps are in the calf or the foot or the toes. Occasionally they're in the thigh, much less common. Any of those actually can respond to treatments. And in my own experience with vein problems over the last 25 years of my life, most recently, actually about a year ago, I started getting cramps again, which I'd had previously before I had treatments which made them go away. These cramps were coming back, and I knew immediately that meant my veins were misbehaving. I had new vein problems. And the remarkable thing about my particular experience is I was having terrible cramps in my thighs that were the most painful I've ever experienced, and that is the experience that patients tell me as well. The cramps are really excruciating. What was interesting from a medical standpoint for my particular case, since I knew the details of my own symptoms and then also where the abnormal veins were, is that all my abnormal veins were in my calf. When they were treated with injection treatments, the cramps in my calf and also in my thigh went away. So there's a strange phenomenon how these cramps develop. It's probably related to nerve reflexes in the legs, going from the leg to the spinal cord back to the leg, and somehow when you do a vein treatment, it settles down that abnormal irritation. So leg cramps can improve and go away after treatments. So another another question people ask is, what is the most common symptom that people see with a vein condition, or that we see with a vein condition? And it's a surprise. Most people would never guess this. I didn't know it certainly when I started doing vein treatments, and that was over 15 years ago. I started in 2005, I think, 2004. But the most common symptom, present in probably 98% of the patients we treat, the most common symptom is fatigue in the evening. People are wiped out. They don't have energy. And as the condition worsens, which it is guaranteed to do, that's the nature of a vein condition, it gets worse every year. The fatigue gets worse. And when the fatigue gets worse, people end up sitting around, not having the stamina or energy to do what they would naturally do, go walk, do things, be active, burn calories. They end up sitting around a lot. The exception to that, of course, are people who are forced to do things in the evening. They have to cook dinner, they have to take care of their kids or their family. But if they had a choice, they would hit the sofa, or probably more commonly the recliner, and take a break and not do anything. They just don't have the stamina or energy. And it's interesting also, on that note, this fatigue problem that people have is it's very typical for people to hit the sofa, or more commonly the recliner. I would say 90% of people we see find a sofa or recliner in the evening, and they want to go to it and just chill out to get there. And that the combination of sitting down but also elevating your legs is what gives people some relief. Elevating your legs for these people will take some pressure off the painful circulation in their legs. The veins are under pressure, that they're not working properly, and pressure builds up after being on them all day. So elevating the legs does help, but it doesn't make it completely go away. And I know that from a personal experience, because I've had vein problems on and off for many years. It doesn't go away, because what happens in your circulation all day long, the blood is pooling, it's stagnant, it's not flowing, it's not working the way it's supposed to. And the body has a specific response to stagnant blood flow. And wherever there's stagnant blood flow, the body has an inflammation reaction. Inflammation is a normal part of the body that fights an infection, causes healing if you have an injury or trauma. And in this case, the body's reaction is not appropriate. There's really no injury, there's no reason for inflammation to be there, but the body is reacting as it can in only a few ways. And this inflammation builds up in your legs. It's very tender, causing tender legs. It's very sore. It causes fatigue of the muscles, and the fatigue also circulates throughout your body, and you feel just run down, wiped out. And this is what people say. They say, I just feel like I'm getting old. I feel like I'm, just run down. I feel like there's nothing that can be done, because I don't see any reason why I should be feeling this, except I'm just getting older. I hear that from people in their 30s, their 40s, their 50s. And I actually learned from a nurse in my office who was listening to a patient's story, and she was talking to a nurse who said, "Oh, I'm so tired at the end of the day. I'm on my feet all day long. Of course, that's normal. I'm just exhausted. I'm up on my feet all day working." And my nurse said very directly to this other nurse, "Look, let me tell you, it's not normal to be exhausted at the end of the day. It's not normal." And then she gave the example of herself. She works all day and she's not exhausted at the end of the day. So that was kind of like splash some cold water in my mind, and that is the truth. What's normal for people at the end of the day, they've been working all day, and assuming you have good sleep hygiene, you sleep well at night, which most people with vein conditions don't sleep well. But if you're sleeping well, you have a busy day, you come home, you rest for 15 minutes, and then you're rejuvenated, you're ready to go. People with a vein condition, that doesn't work that way. They sit down and rest, and they say, I don't want to move, because the inflammation is building up in their legs, and it continues to build up even after they sit down, because the body has a response, creating this inflammation that once it gets generating itself, it keeps going and going and going until it takes all night long to finally settle down and go away. So by the next morning, people say their legs feel better, not normal, but they feel better than they did the night before. And that's because it takes that long for inflammation to get cleared out of the body, about 12 hours. Okay, so here's another question I get from people. And sometimes people ask me the question, but more often I read between the lines and I see that there is a concern there, and so I try to address it proactively, because people know that vein condition can be associated with some very serious complications. The most serious complication is a DVT blood clot, and even more serious, a blood clot that travels up to the lungs called a pulmonary embolism, and people die from that. It can be very serious. And the good news is that for most people with a vein condition, the risk of a DVT or a pulmonary embolism is very low. There are some very specific conditions that I have to look at the anatomy and tell people if it is a risk for them, but most of the time it's not a risk, especially if you have bulging veins in the calf. If you have bulging veins in the thigh, there is a higher risk that if that were to clot off, then that could travel up into the deep veins and actually cause problems. Most of the time when people have a vein condition, they don't know they have it. And so they just have abnormal circulation under the skin. You can't see it. We know it's abnormal when we use an ultrasound, but you can't visually see it. And those people really don't have a significant risk of any kind of major complication like blood clots or pulmonary embolism or death or anything like that. When people have a visible vein, and that's called a varicose vein, the bulging veins on the leg, that occurs about 20% of the time. Those people are at risk for having those bulging veins close off. When it closes off, it's called phlebitis, which is a medical word for inflammation associated with a clot in the vein. And most of the time, as I mentioned, if it is present in the calf, it's not dangerous. If it's present in the thigh, it has a higher chance of traveling up the thigh into the groin and into the deep vein system, and can be a risk. The simplest thing to do when you have that happen is to get an ultrasound, and make sure you make sure they look at it and see how are the deep veins doing. So most of the time I tell people a vein condition is not dangerous, it's not a high risk. There is a very rare situations which is very specific to someone's anatomy. The best way, if you're concerned, is to figure out if you are at increased risk, is to get an ultrasound and get an evaluation with a vein specialist, and they can tell you if there's anything to be concerned about. Most of the time it's not. So therefore, for most people, the reason to get treatment of their vein condition is because they want to get relief from their discomfort, and probably more important, they want to get the benefit of improved circulation, which the treatments do improve by increasing the speed of the circulation. And as a result of that, they get more active, they can burn more calories, they can maintain their weight, they can lose weight, they can maintain good cardiovascular health. So that is really the common reason for people to choose a treatment. So, and I think those are the questions I got from people, and I hope this is of some benefit. If you have questions, you can reach out to us. We have a chat opportunity on our website, MissouriVeinCare.com. You can call our office. There's an email option as well, and reach out to our staff. We have a team of excellent trained nurse specialists who can answer questions for you. They can reach out to me if they're not sure, and I can get the answer to you. So have a great day.